Now, some of the things we think of are typical risk factors for heart disease. So we think about high blood pressure, hypertension. We think about high cholesterol level or hyperlipidemia, hypercholesterolemia. These are two huge risk factors for heart disease. But other things can include things like a family history of heart disease. So many members of the family having heart attack or stroke, particularly at a young age, maybe in their 50s or so. Those who have personal history themselves of diabetes, this is a big risk factor for heart disease. And then, of course, smoking cigarettes. So we do not recommend you smoke cigarettes. It's definitely something that is known to be associated with an increased risk for heart disease. It's one of the traditional risk factors for heart disease.
We sometimes rely on protein supplements or powders, which is not a good idea. So the common lean sources of protein that we would prefer in our diets would be, again, the poultry, the fish, beans, lentils, tofu, and Greek yogurt is a good source. And try to put a variety in you, even in your snacks, because when we plan snacks for ourselves, it's full of carbs. Chalo chips khaye, but let's try to incorporate some Greek yogurt in your snacks. And then plant-based proteins, जैसे आपके nuts हैं, quinoa है, seeds, legumes. And when you're consuming proteins, again, water is important for proper digestion of proteins and utilization. It's very, very important. When you're incorporating protein diet, I mean, protein खाना है, पानी भी पीना है बहुत ज़रूरी. And the पानी, opt for plain water. Make sure you're not consuming those beverages, just make calories bhi hongi.
Now, this is actually a very practically relevant question. For women who do more physical activity, household type chores, such as vacuuming or cleaning around, cooking as well, sweeping, and all those types of stuff, is that sufficient for physical activity, or should they be practiced separately?
Oh, such a great question, Sister Zahra. And I wish it could, add into our physical activity, but it's not the case. The thing is that when we do workout and when we do physical activities, we involve our muscles and we train our muscle in a certain way, right? When we do workouts, we move our joint in a certain and safe moves, right? And when we also doing workout, our heart rate goes up in a very scientific way when we design the workout program. So we keep everything in mind, the muscles, joints, and then blood circulation, everything in together, right? But when we do household chores, we don't think about it.